Welcome everybody to the orientation for our new Native Connections cohort for grantees. We're so pleased that you're here with us today. We have quite a bit of information to cover with you, and we're very excited that you're here. Before we start, I want you to know that we are recording this webinar, so we're aware that we're going to be sharing a lot of information with you. So please don't feel like you need to write everything down that we're sharing. You'll be able to replay this webinar and have access to this information in several hard copy forms, et cetera. So we just want you to take all this information in, and of course we'll be pausing for questions and answers throughout the time because we're aware that we're going to do a lot together today. So you can see the names there of your project officers. One of those names should be familiar to you at this point. One of those folks is your GPO, and you're going to be getting to know them a little bit later on in this presentation. So here's what we're going to cover today. We're going to do some introduction to the grant itself. That's going to be myself and my colleague, Kameisha Bennett. Then we're going to talk about the Tribal Mental Health Technology Transfer Center. Our colleague, Humberto Carvalho, will be talking to you briefly about that. We'll do some introductions to your GPO. That'll be me and Kameisha again. And then we'll talk about some data entry that's required as part of this grant. Angela Mark will talk about that. And we'll end with some budgetary information. Our colleague, Luis Velasco from Grants Management, will be covering that with you at the end. So welcome to Native Connections. This is an exciting program that is all tribal, and it is specifically designed for American Indian Alaska Native tribes and communities. This is the fourth round of funding. It's a relatively new grant, but we do have some active grantees now that we've learned a lot from, and that experience has informed the grant as we've gone along. So you have the benefit of cohorts that have come before you. There is an overall program emphasis on community-based planning that results in systems change to benefit Native youth up to age 24, and we encourage you to think of this opportunity as part of a long-term movement or an ongoing initiative to improve services and supports rather than just another project. So this is engaged in long-term systems change versus something that just comes and goes. So this is from the original funding announcement. It should look familiar. The purpose of Native Connections is to prevent and reduce suicidal behavior. It has a focus on American Indian Alaska Native young people up to and including age 24. It's really about reducing the impact of mental and substance use disorders, fostering culturally responsive models. That's very important. We'll talk about that more. And it's also about encouraging communities to support youth and young adults as they transition to adulthood, so especially that 18 to 24-year-old age range. And it's about collaboration between the agencies there in the community. And so this is a visual of what sometimes happens when you don't get everybody to the table at the beginning of an effort. Sometimes what happens is young folks who need the assistance are just kind of receptacles. They kind of, the programs are enforced on them rather than something that they are engaged in, something that they participate in. And sometimes the programs are kind of siloed and act separately, and so sometimes they step on each other's toes, or sometimes, you know, someone drops the ball. And so what ends up happening as a result of all of these conditions is that young people who are in crisis fall through the cracks, and this is something that Native Connections is committed to addressing, and something that we take very seriously as far as filling gaps in communities to make sure that doesn't happen. So the way that Native Connections is structured is there are things that you focus on in year one, and those help lay the groundwork for what you do in years 2 through 5. And so these are all things that are going to be part of what we'll work with you on for your first year. And we're going to have particular phone calls and tools to share with you to help you with these processes, but essentially you'll be hiring your staff, looking to engage your community, doing a community readiness assessment, working on your policies and procedures, setting standards of care for your youth, looking at those transitions between the care, and then understanding and deciding the roles of traditional healing and Western approaches. And so once you go through the foundational part of year one, Years 2 through 5, we work with you on what's called a strategic action plan, and you, based on what you learn in your first year, we work with you to determine what the universal, selective, and indicated approaches will be, things that will be community-wide versus things that are specifically focused on youth at risk. And so in the funding announcement, you probably saw language in there about evidence-based practices, and we know that in tribes that's just not something that is clear or cut and dried, because there's an understanding here at SAMHSA that evidence-based practices aren't something that necessarily applies to everyone. There aren't EBPs for every population. And so I really want to draw your attention to that third sentence there at the bottom. Tribally based interventions are considered evidence-based practices. So please, as you start to form your program, we want you to know that culturally based approaches are valuable and important to this program. So here are your colleagues in cohorts 1 through 3, and we do have a grantee buddy program where folks will be matched with other grantees so that you have someone else that you can chat with and exchange ideas with and get help from. And these are these are 3 cohorts that came before you that have done a tremendous amount of work and have an amazing amount of wisdom. So we're real excited for you to get connected with them. So you can see this is 148 grantees in cohorts 1 through 3. And then this is you. This is cohort 4. So you're part of this group, and there's quite a few of you too. So this is a huge community of Native connections. It's grown very large, and we're glad that you're here. So one of the things that you may have noticed in the funding announcement was a requirement for the project director to be 100% full-time on the project. And this is something that we find is helpful to make sure that the project is successful. We recognize sometimes people split their time, and it's a common condition, and so we want to try to avoid that so that folks can really focus in on Native connections. It's a lot of work, and it requires some focused time. So if you are covering as project director for now, which is common in the beginning of a grant, that's okay. Once you have someone hired, you're going to do a change in the project director in the ERA Commons system. And we have instructions loaded up for you. You can download those instructions. You will select File in the upper left-hand corner of your screen, and you'll select Transfer. It will give you the option to download some documents. You can choose the ERA Change in PD document. There will also be some other documents in there. You're free to download all of them if you wish. But that one is in there for you as a cheat sheet to help you with that process, because we recognize that is a common thing that sometimes people need to do at the beginning of a grant. All right, so there are several resources for support that you can anticipate as part of being a grantee. There is a Native Connections Program website on the SAMHSA website. There's your funding opportunity announcement, which contains a lot of information. That's the thing you responded to. Also, your notice of award has the terms of your award, and we also have a technical assistance center that has some archived resources as well. So we've got webinars up there and all kinds of tools that the other cohorts have generated. So you're walking into quite a bit of history with this program. But the final one here is one that Humberto is going to talk to you about, because this one is one that you specifically as grantees will have access to, and that is the Tribal Mental Health Technology Transfer Center. So I'm going to have my colleague Humberto talk to you about that now.
Thank you very much. Welcome, everybody. This is Humberto Carvalho. I am actually the GPO for a program called the Technology Transfer Centers, which is a new initiative from SAMHSA that take up, it's all based on the old ATTC. Some of you may be familiar with the Addiction Technology Transfer Centers, and you may have had contact with Anne-Helene and her team at the University of Iowa. So, you know, this new program, the Mental Health Technology Transfer Center, is pretty much following on the steps of the Addiction Technology Transfer Center, which is pretty much support for treatment. But now we have a whole new program that is focused on the support for mental health. The recipient is also Iowa University, exactly the same group. They have expanded their group, so Anne-Helene and Sean Baer that may be familiar to you all. They are now managing the Addiction Technology Transfer Center, the Mental Health Technology Transfer Center, and also the Prevention Technology Transfer Center. But the focus of the talk today is about the Mental Health Technology Transfer Center. Like I said, they sit at University of Iowa, and you can reach more specific information about that network by clicking on the website that is listed on this slide. So the goals of this project as listed there is pretty much to foster regional and national alliances and bidirectional informed communication among culturally diverse practitioners, researchers, policymakers, family members, and consumers of mental health promotion and treatment service. It's also to enhance the technical assistance infrastructure, training and technical assistance infrastructure to support programs and workforce serving tribal and urban Indian communities, to facilitate expansion of culturally informed knowledge and skills for effective mental health service to American Indian and Alaska Native populations, and to prepare for culturally informed evidence-based practice implementation. And last is also to accelerate the adoption, implementation, sustainment of mental health-related trauma and culturally informed evidence-based practices across the lifespan and across tribal and urban Indian communities. We'll go to the next slide. So this is pretty much a list of the services that this Mental Health Technology Transfer Center provides. As you can see, this is not a technical assistance contract service like SAMHSA used to provide, and I still believe that they still have some technical assistance contracts in place, but this is not a technical assistance contract. This program is actually a cooperative agreement that we have with University of Iowa, and they will serve the SAMHSA grantees as well as other Native American population providers, but they pretty much delivering this training and technical assistance in the format of face-to-face meetings, webinars, conference calls, and other virtual meetings. So you can contact them and request for specific content, with specific materials. If you are interested in specific trainings, they will have a whole menu of trainings and specific focus areas, deliverables, materials that they will prepare to help the providers to enhance their knowledge on how to deal with mental health issues in Native American communities. So again, you know, they are not set up to provide individualized technical assistance. So it's not like you can request a technical assistance and someone will show up in your organization and spend like a day, 2 days, or even come back later, you know. So that's pretty much how it is. So you have there, which is pretty much a menu of activities and trainings and opportunities that they will be offering for anybody. And again, I would suggest for you to go on their website and register to receive their, to be enrolled in their listserv. So this way you'll be receiving communication often, like weekly or monthly, in regards to the events and trainings and opportunities that they're going to be implementing and providing for that you may want to take advantage of. So next slide. So this is pretty much just a very quick overview of the program. If you need any additional information in regard to this program, please feel free to contact me at any time. This is my contact information on the slide over there, slide 17. And I will be open for questions after my next colleague to talk to you. Thank you.
Great. Thank you, Humberto. My name is Kameisha Bennett. I want to speak with you all about the role of the SAMHSA Government Project Officer. So your Government Project Officer, also known as your GPO, serves as your primary contact for this grant program. We work in partnership with your grant management specialist, Louis Velasco, who you'll be speaking or hearing from later. The role of the Government Project Officer is really to support you throughout the life of your grant. So we will be monitoring activities and the progress of your project. We will review any requests or changes to your project and talk that through with you. We'll work to help you navigate the federal system and work to support you as you communicate with the others on your federal team. We also assist with reviewing and approving any submissions for standard and special terms and conditions. We review the required reports and we provide feedback to you all, either by way of email or on our calls together. We're also going to share any announcements and share other resources that we can provide to you. And we'll be overseeing and approving SPARS goals and quarterly data submissions. And Angela Mark, one of the other GPOs, will be speaking with you about SPARS shortly. So we wanted to take a moment just to put faces to the names that you've seen. As I just shared, my name is Kameisha Bennett, and listed below my name are the grantees that I will be working with. I'd like to speak on behalf of all of the GPOs to say that we really do look forward to working with you. You've probably heard from us already, and if you have not yet, please reach out. This is William Reyes. He is housed in the Center for Substance Abuse Prevention alongside myself and one of the other GPOs. We're a shared program, so we work in both the Center for Substance Abuse Prevention and the Center for Mental Health Services. This is Irene Darko, and these are the grantees that she will be supporting. Again, as I mentioned, this is Angela Mark. She'll be speaking with us in a moment about the SPARS program. And then you heard Michelle Carnes' voice earlier. So next steps as you get started. So if you have not already heard from your Native Connections Government Project Officer, please reach out. We're going to be sending you additional information very shortly, so you'll learn more about what's coming next. We're going to be starting up our grantee monitoring call shortly. So in the meantime, please take a moment to review the welcome email that you should have received from your GPO, and you'll also be receiving information on some of your year one deliverables, which will be the community systems analysis, the community readiness assessment, your strategic action plan, your crisis response, and protocol development as well. So we're pausing, as we promised, to respond to any questions that you have regarding the information that has been shared at this point.
For questions over the phone, if you'd like to ask, please press *1 at this time. Again, for questions over the phone, please press *1.
And while that's going on, there was a question that was asked to us. What about tribal tech, the TTA earlier grantees have access to? That contract is not part of this cohort, and so the Tribal Mental Health Technology Center that was described earlier is the resource that this cohort will have access to. So thank you for asking that question, and we're grateful that so much of what Tribal Tech has already done and the groundwork that they have laid in terms of webinars and tools will still be available, and we'll be able to share that with you as an incoming cohort, but that the support that you will receive as a grantee will come from the center that Humberto just described.
And we did have a question on the phone. Question comes from Betty. Your line is open.
Okay. I have a question regarding the project director. I noticed that it requires an approval prior to hiring a project director. Is the common system ready to upload? I attempted that last week, and I did not see an option. I saw the upload options, but it did not give me a window that would allow me to add the project director. Is that available at this time?
I mean, so you should be able to submit a request in the ERA Commons system. If you're having trouble, I guess we can speak after the call or arrange a time to sort of help with that. But yeah, you should be able to submit a request. I mean, the first step should definitely be, though, for the individual you are proposing to become project director, create an ERA Commons username or account for them, because that'll be something we would have to link them up to in the system once we go through our process of approval to make to link the correct individual and their account with the grant.
Okay.
So this is Luis Velasco speaking. If you can send me an email, then we could maybe try to help one-on-one with the issues.
Okay, will do. Thank you.
And also check out those instructions and see if maybe the instructions can be helpful.
Right.
But yeah, one way or the other, we'll figure it out.
Okay, thank you.
The next question comes from, I was unable to get the first name, but I did get the last name. Maxwell Kane, your line is open.
Hello, I'm Marisa, and I'm with the Ute Mountain Tribe, and I accidentally got onto the just part of the introduction here. So I know you're being recorded. Is there a way to get the slides and the recording after the fact?
Yes. So if you go to File and select Transfer, the slides are there for you to download, so you can get all of the slides together to save for yourself. And then there's a link in the original invitation that allows you to replay this webinar 24 hours after the webinar takes place. So sometime tomorrow you'll be able to replay this so that if you don't memorize everything we're telling you, which is okay, you can replay the webinar.
Thank you.
Yeah.
Mm-hmm.
At this time, I'm showing no further questions over the phone.
Okay. Well, we'll have more opportunities for questions. We just wanted to make sure that we pause before we hit you with more information. So we will continue now with our colleague, Angela Mark, who's going to talk to you about data collection and SPARS for Native Connections.
Hi, my name is Angela Mark. I'm a project officer working on this program, and I'm going to spend approximately the next 15 minutes doing an overview of SPARS. And so here we have a slide. So how do we know Native Connections is working? So these are the things that we're looking at. We're looking at new policies that have been made as a result of this program, new partnerships as a result of this program, newly implemented tribal and evidence-based services, number receiving tribal and evidence-based mental health or related services after referral, number of substance-related, suicide-related, and alcohol-related ER visits in the community, and the total number of youth served or reached as a result of this grant. Oops. Okay. So I'm going to do a quick overview of SPARS. I'm going to be discussing entering your annual goals in budget. I'll be talking about the 4 required indicators, quarterly data reporting, and period and deadlines. And so I also want to just caution everyone that if you were a sub-grantee from a different cohort, that data requirements do change yearly depending on the administration and SAMHSA's congressional justification. So what indicators may be in a different cohort, they're going to be different in this cohort. Also want to alert you to 2 documents that you'll be able to upload. I believe Michelle sent out instructions on how to do that from this webinar. And so those 2 handouts are going to come in handy. One of the handouts is going to be a cheat sheet, and it's on establishing annual goals and budgets, and it's literally like step-by-step instructions. And then the other document is going to be, well, it's titled SPARS Program Guidance on IPPs. So whenever we talk about IPPs, know that that means the 4 indicators that I'll be talking about shortly. So what is SPARS? So SPARS is SAMHSA's Performance Accountability and Reporting System. So this is a web-based consolidated central data platform. And this allows us to measure programs and grantee performance. And so you as a grantee are to report data only on the Native Connections grant-funded activities. So some communities may have several grants, whether it's MSPI, GLS, whatever it may be, but make sure that you're only reporting data on Native Connection activities and activities that are funded by this program. So SPARS has two program components, annual goals and budget information, which is actually going to be due January 31st of next year. You'll be required to submit those. And just know that we're going to be asking for you to submit those goals and budget for the next 5 years. But don't worry, we do open it up yearly, usually in December. So when year 2 comes around and those things, you know, definitely are going to fluctuate or change, you can always update that as needed. And then there's quarterly data. So this is data that you'll submit quarterly every 3 months, and your first quarter data is due January the 31st, 2019. So you have 2 upcoming due dates that are due at the end of January. And so when I say first quarter data, just know that this means data from October, November, and December of 2018. So many of you have been working on hiring or getting ready on the ground there to start this program, and you may not have lots of data, you may not have any data, and that's perfectly fine, but you still are required to go into SPARS and enter in no new result, and I'll talk about that shortly. So even though you may not have anything to report, you're still required to go into SPARS. Okay. So SPARS annual performance goals and budget estimates. So this again is due January 31st of next year. So you'll log into SPARS, you'll enter in your annual goals for all grant years. You'll also enter in your budget estimates for all grant years. You'll click on Submit to GPO for review and approval. And if you have a question about entering in budget estimates, and I'll talk about this in the next few slides, but just remember to always refer back to your, we call it the NOAA, it's your Notice of Award. So that can give you a lot of information regarding your budget and your awarded amount for that year. Purpose of annual performance goals. So you'll quantify what you plan to accomplish with this program. You'll tie it to your work plan, so just remember to be realistic and attainable. This is used for performance and program management. And if you ever need help, remember that you can always consult with your government project officer. And so just one example that I would like to give you is, for example, when I say realistic and attainable, an example might be policy. So this is going to be one of your indicators that you're going to be required to report on. And so when we're talking about something like policy, an example of that may be crisis protocols. And so you'll put that into your annual performance goal. And it might not be for year 1 that you know, or might not be, it's definitely not going to be year 5. Part of the program is that you'll be required to be developing or revising crisis protocols. And so that is one example of policy that you'll put into that annual performance goal. There are 6 budget categories in SPARS that you're creating budget estimates for. They are infrastructure development, data collection and evaluation, and just a side note on this, make sure that the amount that you estimate for data collection and evaluation does not exceed 20% of your annual grant award. Mental health promotion and prevention, grants administration, services provision, and technical assistance. So include all direct and indirect costs associated with each budget category. It is okay to estimate direct and indirect cost, but do not include in-kind contributions, match costs, or carryover dollars. So how to enter data into SPARS. So SPARS should have reached out to each grant individually. There are a few that I know that they haven't reached out, and I believe it was because the project director was not noted in the notice of award, because you probably didn't know who the project director was. So if that's the case, just make sure that you send a note to your project officer. But for, I think, most of the folks in this cohort, SPARS has already reached out to you to start to get you established with user IDs and passwords. So this is the SPARS data entry system website, and you'll log into that, and you'll enter data only on completed activities and trainings in the quarter that it was completed and funded by Native Connections. You'll wait to enter data on activities that are in progress. So if they're in progress, do not count it until they are complete. If you don't have anything new to report in a category, just click on No New Result to indicate that. So regardless if you don't have any data, just repeating this again because it's pretty important. It causes a lot of challenge on the back end if this isn't done. So just make sure that you're going into each one of these indicators and you're putting in something, whether it is data or whether it's no new result. You'll click on Save, and after you submit your data, your GPO will review and approve or request revisions. So now I'm just going to talk briefly about each of your grant indicators. And so for Cohort 4, there is 4 indicators that you'll be required to collect data on quarterly. The first indicator is policy development, and so this is the number of policy changes that have been completed as a result of the grant. So it could be a pretty broad range of written documents directing on administrative or legislative action or event. Report it once the change is complete, but not while it is in process. So some examples of this are tribal resolutions, that is a policy development. Crisis protocols, mission statements that are written, revised to include suicide prevention, mental health promotion, substance misuse. These are all examples of policy development. Maybe for the larger entities, some examples may be you're creating a flagging system in primary care or things like that. These are all examples of policy. And if you have any questions about that, you can always ask your project officer. Second indicator is partnerships and collaboration. So this is the number of organizations collaborating, coordinating, and resource sharing with other organizations as a result of the grant to improve mental health-related practices, activities that are consistent with the goals of the grant. So when we think about partnerships, we think about partnerships on various levels. So we're looking at partnerships within the community, local, county, statewide partnerships, and beyond. So some examples I have here are maybe you're collaborating with a faith-based task force on prevention activities. You could be partnering with another community on gatekeeper training, or partnering with a university to create support for two-spirited students. So there's, when you really start to look at it and you look at all the different levels, there's many partners that we actually probably, communities already have in place. So these are all considered partnerships and collaborations, and those can be counted. Types and targets of practice. So this is what Michelle had mentioned earlier, when you're going to see evidence-based practices. And when you go into SPARS, you're probably going to see the language evidence-based practices, but you may not see tribally based practices. But just know for this program, it is tribally based or evidence-based practices. When you think of tribally based or evidence-based practice, think of these as interventions that are used and relevant in your community. Your community may already be using these interventions. So some examples here are talking circles. Communities have implemented language curriculum in the school, summer youth camps, American Indian life skills curriculum. And so there's a lot of these different interventions that are used, and adaptation to any of them is fine and is considered a tribally based practice. Types and targets of practice. So this is sort of part two to the slide we just talked about. And so here you'll be collecting the number of individuals that have received tribally based, evidence-based mental health or related services after a referral. So just to give you an example, how we were just talking about interventions in a community. And your community may have a summer youth camp for youth that maybe aren't practicing subsistence, or maybe they're high-risk youth. And so I'll use an example of a Camp Pigok up in Alaska. And so that is considered an intervention. And so you'll be able to count that on the T2 indicator. Now, when it comes time for the T3, you'll be counting the number of youth that attended Camp Pigok. So there may have been 25 youth that attended that. And so that will be the data that you'll be entering in for T3. So every quarter, you are required to log into SPARS and do the following. So you'll be entering data on completed activities in the quarter that it was completed, remembering not to enter in activities that are in progress. If you have nothing new to report, you're still going to click on each individual indicator and type in no new results or click on no new results, which is completely valid. I mean, we don't expect for you to always have, you know, lots of data. So it's fine. It's fine. I hear from a lot of communities, but I don't have anything to report. It doesn't mean that you didn't do anything. It's just that you don't have anything to report. After you submit your data, your government project officer reviews, approves, or we may disapprove or request revisions. And if we do that, you will get an automated email just saying, hey, your project officer had some questions about this. Can you please go in and revise this? Is, you know, and we'll type out exactly what we had a question about. And at that time, then you'll have an opportunity to make edits and revisions to the data. Okay. What if I do not have any data to report? So remember, just remember, if you don't have any data, just click on the indicator, click on no new results, and submit. And that is completely fine. And so this is just a visual of quarterly reporting periods for the first year and what it looks like. And so if you pull up one of the documents that's been downloaded on this webinar, you'll also, and you print it out, you'll be able to see it hard copy. And actually, you might want to print those two documents out. You'll be referring to them and using them quite often. So again, first quarter data is due January 31st of next year, and that will include October, November, and December. So after you submit it, the project officer then has a month to review it, and will give you time to revise data if necessary. And after all that is complete, the system eventually does lock. So just it's important to make sure that the SPARS requirements are timely. Okay. So SPARS staff resources, so you can always reach out to your project officer if you have any questions at all. The SPARS help desk, which I've used quite a bit, is actually pretty responsive and really great to work with. So they're always available. And they're also always hosting webinars and data clinics for grantees. When you do log into SPARS, there is a training tab that you can click on, and you'll see all of the trainings that are they're pretty constant trainings. So this is the last slide, and it's not a part of SPARS. However, it is a requirement for this program. And so this is an additional data collection that you'll be collecting on your own, and we will be asking for this information annually. And most likely we'll be asking for it with your annual report, your yearly report at the end of each year. So you'll be reporting on the number of substance use related. This includes opioid related ER visits by youth. And again, this is under the Native Connections program. The number of suicide-related ER visits by youth served under this grant, the number of alcohol-related ER visits by youth served under this grant, and the total number of youth, again, up to and including age 24, youth that are served and or reached as a result of this grant. So you can collect this however you want. You can create your own chart, but this is a requirement, and we will be collecting it yearly. And that is the end of the SPARS and data requirements. And so I believe now I'll introduce you to Luis Velasco, who will be talking about grants management.
Hey, Angela, I wonder if before we do that, if you'd be willing to address the question from Abraham that says, are participants in universal prevention programs documented under T3?
Okay, was that, okay. Can you repeat that?
Yeah, it's in the chat box. It says, are participants in universal prevention programs documented under T3?
So what would be example? Do we want to open it up? Should we open it up for any SPARS questions, or do we not have time for that? Or we'll open it up at the end?
I think we can open it at the end. We were just wondering if there was a response to this one, but we can come back.
Yeah, I don't see it, but
we'll come back and we'll come back at the end and respond to your question, Abraham.
All right.
Okay.
It's all you.
We'll pass on to Luis.
Sounds good. Hello, everyone. This is Luis Velasco, your grant specialist for this cohort of Native Connections, and we'll talk a little bit about ERA Commons and the different more budgetary grants management related tasks, I guess, or areas of your grant. So hopefully you guys are somewhat knowledgeable with ERA Commons at this point. I know there's still grantees that have technical issues with the system, and we can try our best to help you with that, but there's certain things that we'll have to redirect you to the ERA Commons help desk for, especially when it comes to access your organization, I guess, having issues accessing the grant. But either way, so here's a brief overview on logging into ERA Commons. The homepage this is what you would see if you go to that era.nih.gov web address, and to log in, you'd go to the Commons login circled link on the side. All post-award requests, including significant budget changes, project director changes, responses to special conditions that you guys have been placed on your notice of awards, all those will be now conducted through the ERA Commons system. So if you've had SAMHSA grants in the past, and in the past it was done via email, we're no longer accepting it this way. So I guess we'll just have to work with the system and do our best to be able to get what is needed through the system. So here would be the login page. You type in your username and your password. Especially important for project directors, especially individuals that are being hired or brought into the grant as a project director, they will need their own account in ERA Commons. So that might be one of the best first things to do in the process of hiring and bringing on board a project director, is get them an account. In the remarks section of your notice of awards, of your original notice of awards, there was a little blurb about creating an ERA Commons profile for project directors, and there was a web link there. So I would refer you to that if you need guidance on creating an account for an individual in ERA Commons. So again, you'd log on here. This is what you would see. To access your grant, you'd go to the non-research tab, that rightmost tab on that top row, and either manage post-award amendments or manage continuations, depending on the task you are going to be conducting through ERA Commons at that point in time. So in terms of what you'd probably be doing now mostly is, or have already done, is responding to special conditions and or terms. To access them, there are 3 different ways you can access them. To save, or for time purposes, I won't go too much into detail on each way to get to these areas, but there are images on the next couple slides on how to, I guess, get to that point where you can access either responding to special conditions or terms or submitting a post-award amendment request. So I guess, let's see, yeah, so I'll just go note on this slide, depending on if you're a signing official for your organization or a project director, you may see different screens when trying to access your grant. The project director, the individual in a project director role within the system, they will see all grants for your organization that your signing official has granted you access to. You will definitely obviously have access to your Native Connections grant. But think of the signing official, I guess, as sort of a master account in a way, in that this individual in a signing official role will be the individual that ultimately signs off on submitting post-award amendment requests or continuation applications. But the way the system works is the signing official role, they won't automatically see the individual grants for the organization. They will have to actually search the grant number to gain access to either responding to a term or submitting a post-award amendment request. So that SM, which would you put in the IC box in that top screen, and then the 6-digit number, which is 0, 8, and the next 4 digits, would be how you would search for your individual grant in ERA Commons. So you'll see every special condition or term listed individually in its own row. When you finally get to this step or this point in the process, you respond to each one on its own. So if you were asked to submit an indirect cost rate agreement or submit a revised budget or answer some questions to, let's say, the rent cost that you proposed, you would access it based on how it was listed on your notice of award. You would, I guess, click that plus sign to expand it, and then prepare documentation and begin uploading the necessary documents to respond to the special condition. The system only allows PDF formatted files to be uploaded, so anything you work on will ultimately have to be converted to a PDF to be able to upload, and there's a limit of 10 PDF attachments per special condition you are responding to. You can preview the submission before you submit. You can save it and come back to it, and you can view it as a consolidated response. So I think for this one, that's it. Special conditions and terms, I do not think the signing official role does not, signing official individual does not have to submit it. The project director can respond to this on their own. You'll see in the next slides that a post-award amendment request, as well as continuations, a signing official role in your organization or individual with that role will have to ultimately validate and submit that particular task. So now post-award amendment request, again, the project director role and the signing official role see different screens. That left one is all the different grants the project director for your organization has access to, and they're listed individually. To initiate a post-award amendment request, the project director role, that left-hand screenshot, can automatically initiate from that screen. So you'll identify the row in which grant you are trying to submit a post-award amendment request to, and click initiate. A drop-down menu will come down, and you'll pick which particular post-award amendment request, whether it's key staff or revised budget you're choosing to submit. You can also view the different requests you have submitted via that blue button that's in the orange box. Again, if you were to, let's say, instead of you going directly from that previous screen, if you were to click into a specific grant, this is what you would see. This lists all the post-award amendment requests this grant has submitted. You can initiate from this screen as well, or you can view the status of different requests you have submitted. You'll be interfaced into the assist system, which this is where you'll be working on the different documents and information you need to submit for a particular post-award amendment request. Each type of post-award amendment request has different required documents and tabs. The SF424 cover and HHS checklists are always required amongst all post-award amendment requests when it comes to submitting revised budgets, change in scopes, carryover requests, which we're not going to go too much into detail in this presentation. Those have more required tabs because you have to submit a new budget, a project narrative. If a particular document doesn't apply to any of the tabs that are listed on your post-award amendment request that you are working on, you would submit it under other narrative attachments. There's also that add optional form on the left-hand side where you can also submit a document that may not necessarily apply to the other tabs. So this is where, this is the project director working on a post-award amendment request would review the different tabs. They would, on that right-hand screen has an area where you click ready for submission and submit. The system will run a validation check to make sure all fields are correct. If not, you'll get error messages that need to be worked on. I know there's some grantees that have had issues with trying to figure out what exactly is being asked of in error messages. I'm trying to collect kind of like a common error messages that grantees are getting to sort of maybe put that all together in a document and maybe either help your cohort or future cohorts with the system. But feel free to contact us if you're having error messages that you cannot figure out. If we can't help you, we'll have to refer you to the ERA Commons help desk. We'll try our best. So next slide, you'll see that the signing official role will have to ultimately validate and submit the post-award amendment request that a project director has prepared. And this will be the ultimate sort of submission of the request. That's when we'll get indication or notice that it's been submitted, and we'll then start doing our steps and processes to review and approve said post-award amendment request. In certain instances, we may still need additional materials, or we might have additional questions that need clarification. We would submit these as a request for additional materials, the abbreviation RAM in ERA Commons. You would access it. You would get a notification via email, the project director would, and I believe also the signing official, that a request by us has been submitted, and you'd kind of get to it the same way, work on it, update any necessary documents you may need to respond to us, and submit. The signing official will not have to do this part in terms of submitting. The project director can respond on their own to a RAM request. So we're just going to go into 3 common post-award requests or actions right now. This we define as any activity that takes place after the award has been made and that require, well, certain of these post-award changes or actions require prior approval from SAMHSA, and we're going to review some of these now. As was said before, it needs to be submitted via ERA Commons. A key staff change, budget revisions, and changes in scope, those are the 3 we'll review. And so we'll go real quick into project director changes. The project director for the Native Connections, this Native Connections cohort is the only required position that would require prior approval from us to make a change to. This would be if a new individual is being hired into that role, that would always require prior approval. If and actually, I guess that language about reducing it 25% doesn't really apply to this grant since the project director is required at 100%. But I guess the separation from the project for more than 3 months may still apply. I don't know how common we see that happen, but either way. So that's the only position requiring prior approval from us to make a change to. We'll skip this slide since it doesn't apply as much to that case. These are the required tabs and documents within ERA Commons that you would need to upload for a project director change, a request letter detailing those different sub-bullets. You can get more information on the process at the link that was provided in a few slides before. You need a resume for the individual that's being hired. The SAMHSA checklist is required. That would be its own tab, and it's embedded in ERA Commons, so you wouldn't need to work on that tab outside of the system and sort of scan it in or anything. And important now that we're working through ERA Commons is for a new individual being brought onto the grant as a project director, we need that ERA Commons ID for the individuals to ensure that we link up the correct profile to the grant. So now budget revisions, the threshold for what would require prior approval from SAMHSA for a budget change would be if the budget change is greater than 25% of the annual awarded amount for the grant. And then at the bottom is 4 cases that always require prior approval. The 4th one, the changes in applicant cost sharing or matching aren't a requirement for the Native Connections grant, so you could ignore that one. So just an example here, that first column would in this case be the approved year 1 budget through, that was originally awarded with your initial notice of award. That second column is the proposed budget revision for that this particular recipient wants to change to calculate whether your budget requires prior approval or not. To see if it's over that 25% threshold, you take the differences from each category of the budget and add those up. In this case, the numbers, even though there's pluses or minuses, we're just adding the numbers that adds up to 74,000, and that is 29.6%, so that would require prior approval. In the previous category, one of the sub-bullets about what always requires prior approval was also if a budget category that was previously awarded at 0 is now being proposed for a cost. In this case, an equipment item is being proposed at, or several equipment items at 28,000. Previously, it was awarded at 0, so that by itself would require prior approval from SAMHSA. These are the required tabs within ERA Commons for a budget revision. The 3 additional ones for a budget change are the detailed budget, which is where you would upload the PDF of your new budget, project narrative. That could be any additional, narrative or the letter the cover letter or narrative that you're describing the need for a budget change. That's where you could upload that. And the SF424A, which is that standard form that you submitted with your original grant application. We need an updated one to correspond to the new budget category totals. Change in scope. This is when goals and objectives of your original grant that were approved as such are when there is a significant enough change in your goals or objectives that it requires a change in scope. This is a little more not as well defined, I guess, as a budget revision and what does or does not require a change in scope. If you have questions on whether something you're proposing, something new, or a change you're proposing in your grant requires a change in scope, I would encourage you to contact your project director, your GPO, and we can walk you through that to let you know if a change in scope is needed. A change in scope request, it's very similar to the tabs are very similar, the required tabs to what was required for a budget change. We also ask that even if your budget change isn't changing significantly enough for needing prior approval with the change in scope, we ask that you include the updated budget along with the change in scope with the request, just so that we kind of see the whole picture when requesting a change in scope. I'll briefly touch up on continuation applications because the deadlines usually are pretty early in the grant year. So they have the deadlines for this for year two, your future year haven't been decided yet, but they're usually in past years have been January, late January, early February. So that will kind of creep up on you quicker than you expect, even though you guys are still starting up and everything. In terms of the things that you need to ensure that you're up to date on, the main two here, I guess, in your guys' scenario as being first-year grants is make sure that you've submitted that first quarter federal cash transaction report in the payment management system, which we'll touch on in a bit, and make sure that your system for reward management, your SAM annual registration and DUNS information is up to date and hasn't expired. These will also be submitted via ERA Commons. You'd go through the Manage Continuations sub-tab under the Non-Research tab, and then click View, and you'll only be able to access your next year once we allow, or once the ERA Commons system allows you to access that. You will get guidance on when this is going to be open, when you will have until, and similar to how you submitted the original grant application, you will work on the different tabs and requirements of a continuation application. You'll work through the assist system as we kind of touched on with the post-award amendment requests. We can go to the next slide. The one thing that's different for continuation applications is you have the option to submit a signed and dated attestation letter if your budget has not changed by more than 25% from the current budget period. So similar to how you calculated a budget revision and whether it's over 25% or not, you do that for your continuation year. And this signed and dated attestation letter can take the place of the detailed budget. You could also still include a budget with an attestation letter, but that sort of will, in that case, we would take the attestation letter as sort of your signed confirmation that your budget isn't changing by such, and we'd have just the budget as supporting documentation for processing your continuation application. And then just to touch on the financial reporting requirements for your grants, FFRs, your first one won't be due until 90 days after the end of year one, so that'll be December 31st of 2019. This is submitted via ERA Commons as well. I won't go too much into that because you guys have over a year still until that point. We'll go a little more into that second one, the financial cash transaction report, which I think I called it federal a second ago, but financial cash transaction report, and that's submitted through the payment management system. So this is just the screenshot of the FFR. Hopefully, I mean, if you've had a grant before, you might be a little bit familiar with it. Go to slide 81, I think. Yeah. So the financial cash transaction report, this is due to the payment management system, and that's the system where grant funds are drawn down. Maybe the business officials or the budgetary people in your organizations are more familiar with this. but they're due 30 days after each calendar quarter. So, I mean, technically your guys' grant started September 30th, so I'm unsure if one was due for that one day that your grant was open for. In that case, I'm assuming you'd probably just report 0, but your first, I guess, more substantive report will be due January 30th. That will cover the October through December time period of your grant, and then so on and so forth, 30 days after each calendar quarter. We ask that you pay attention to those days because your payment management system account may be restricted if the reports aren't submitted on time. It asks for similar information that is asked for on the FFR, and so hopefully by the time the FFR reporting comes along, you'll be a little bit familiar with that, being that you've reported already 3 or 4 times. So, expected upcoming dates and deadlines. As I said, year 2 continuation applications, I expect the date to be sometime in late January, early February of the upcoming year, 2019. Year 2 continuation applications, expect those awards to go out sometime in the summer. Late June to early July has been the trend recently. And your end of year 1 FFRs and progress reports, programmatic progress reports, are due 90 days after the end of the budget year of each grant year. So it will be, your first ones will be due December 31st, 2019. Preparing your budget. I'll just kind of try to go through these quicker. That first link is a good guide on allowable and unallowable costs. That is sort of the uniform administrative requirements for all HHS awards. If you are unsure about the allowability, or if you sort of want to defend a cost you're proposing and you want to beef up the reason why you're proposing said sort of questionable costs, if you have documentation and sort of like the thinking behind why you think this cost is okay, citing that is definitely a good guide to have. Provide as much detail and breakdown as possible in your budget. SAMHSA funding restrictions, common ones, are the light snacks at $3 per person and incentives at no more than $30 per person per incentive. That's the mistake that I caught too late for this Native Connections grant. I left the FOA restrictions for a previous CMHS grant program, but the FOA restrictions for Native Connections, that first line, not the first line, the infrastructure is not a cost restriction, but for Native Connections, no more than 20% of the grant award can be used for data collection costs. Make sure to include that in future budgets, in future continuation budgets, if you need to include them with your continuation applications. Cost sharing is not required with Native Connections, so disregard that third sub-bullet too. For personnel costs, for individuals on salary, include their annual salary and their level of effort. If they're being charged by hourly rates, include their rates and number of hours. For travel costs, if you're proposing flights, that link is for the City Pairs program is what we refer to for what sort of is the cap that we can allow for flights. For hotels, we use the GSA established lodging and per diem rates for the different geographical areas. Use that as sort of a cap for what you're proposing in your budget. For mileage reimbursement, follow the IRS rate, no more than the 54.5 for 2018. You know, for equipment, $5,000 is sort of, for an individual acquisition cost is what we define whether something should be an equipment item or supplies. And then contractual costs, I know that's probably the hardest thing for you guys to get us detailed budgets on, but we ask that you just do your best to provide as much detail as possible. It's probably the most common question we go back to grantees for on budgets not being detailed enough. For indirect costs, if you're proposing something greater than just that de minimis 10% rate, which all grantees have an option to do, you need to include your indirect cost rate agreement with the budget. Pay attention to the direct cost-based language, which is what you can charge off of for the indirect cost, for indirect cost total. The next slide goes into detail on how to, different sort of examples of direct cost-based language. I won't go into it in detail, but that's just to have as a guide, and I guess questions or answers. Hopefully you guys are still awake.
Once again, as a reminder, to ask a question over the phone, please press *1 at this time.
And while we wait, we can go to a question that we received during the presentation. Is it possible to delete an attachment I attached to the wrong condition?
So if you've already submitted a response to a condition, we would have to return it to you before you're able to, I guess, start working on it again. So, and I think you asked the question earlier, Betty, so I'll look up, and I think you have emailed me about this before, I just haven't gotten back to you, but I'll go back in the system and I guess return that special condition if that's the problem, and then you can work on it again. So, and it's for some reason 2 conditions because you have to delete one and bring it back to the other one, then yeah, we'll figure it out. So yeah, so basically if once you submit a response to a special condition, the system doesn't allow you to work on it again and make any revisions until either me, your grant specialist, or your project officer returns it for you. Unfortunately, that's another step that has to be done before you guys can work on it again, but that's the system that we're working with.
And once again, for questions over the phone, please press *1. I'm showing no questions over the phone.
Okay.
All right. Well, in that case, we will, this will be available for replay 24 hours later. In the Outlook invitation that you received, there was a link that will take you to this presentation. So if you need to review it or share it with others on your grant team or your fiscal team, we would invite you to do that. Again, these are your project officers for Native Connections. We're really excited to work with you. And we appreciate you being with us today. Please do look for that welcome email from your project officer, and we'll be in touch with you to set up some contact with you so that you can get started with your grant, but please reach out to us in the meantime if you need assistance. But we appreciate you joining us today, and we hope that this has been a helpful introduction to joining Native Connections. Thank you.
Thank you, and this does conclude today's conference. All parties may disconnect.